Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navipet, Pune. Today, let us talk about the difference between ovulatory and unovulatory PCOD. Now, whenever you hear the word PCOD, it's become extremely common these days, and especially in our sector where we are doing assisted reproduction like IVF, ICSI, test tube babies, we get around 20 to 30% of our patients who are suffering from this PCOD disease. PCOD may not always affect your menstrual cycle. It may just start by certain hormonal imbalances which may affect things like you may have baldness which can start from the frontal area, something which is known as the male pattern baldness, or you have too much of hair on your beard, mustache, skin areas which is known as hirsutism. You can have increase in the weight which is 5 to 10 kg weight gain, sudden increase, or if the patient may be absolutely thin but may have menstrual irregularities. So these are certain symptoms of PCOD which are seen in patients who come with infertility, and the main types of PCOD patients that we encounter are the ovulatory and the unovulatory PCOD. Now, in ovulatory PCOD, the egg is getting produced and recruited by itself. Within 2 weeks, the egg develops nicely. Because of good hormones, it ruptures by itself without taking any medications or injections for rupture, and the patient still cannot conceive. So, she is a patient who can develop her own egg, can have rupture of the own egg but cannot conceive. In unovulatory patients, however, neither is the egg getting recruited nor is it getting ruptured, and hence because the egg doesn't get ruptured, there are a lot of cysts in the ovary which are nothing but fluid filled spaces where the eggs were there, as a result of which the hormones goes into severe imbalance and patients might result in complete amenorrhea, that is stoppage of menses. These unovulatory patients on sonographies show that there is no ovulation, that is no egg ruptures, and apart from that they face very much severe menstrual irregularities in the form of sometimes patients don't get menses at all till we give them medicines. Some patients bleed once or twice in the entire year. Some patients can have menses once in 4 months, once in 5 months, thereby resulting profound menstrual irregularities. So if you are having these kind of irregularities and infertility, kindly go and see your IVF consultant whether you are the unovulatory type of PCOD, and around 20% of unovulatory PCOD patients, irrespective of their age and ovarian reserve, might still need a test tube baby to get pregnant. Thank you.